prioritize hypothesis. What is that about? With this ability, you need to develop the technique or ability to narrow down what the data means and what is the most important. So what does this mean? Let's say that the clinical scenario is as follows. A 42-year-old postpartum client who just gave birth to a third child in 4 years reports severe afterbirth pain of 9 out of 10. So in your mind, you have to be identifying some key factors. For example, the age, 42-year-old, gave birth to the third child. So it's a multipara. It says that the patient now has severe pain. So it's describing, using an adjective to describe the severity of the pain. Severe, 9 out of 10. That is important. So we see right now that the first problem is pain. Is there any other problems? Keep reading. The client also reports. That's a keyword to tell you there's more. What else? What's happening? Well, also reports problem with the baby to latch for breastfeeding. So that is another problem that we have. Breastfeeding problem. But then he says, the nurse conducted an assessment. You see, up to this point, all we have is referred information from the client. Pain, difficulty with getting the baby to latch. But now, the nurse did an assessment. Is that important? Of course. Of course it's important. It can help you prioritize. So the nurse assessed that the client has a bulgy uterus and is, keyword here, saturating a peripad every 20 to 30 minutes. Why is this word important? Saturating. Saturating the peripad is telling me that this patient is bleeding. And the bulgy uterus tells us what's going on, why they're bleeding. So as we analyze this question, we have to formulate a hypothesis and prioritize what is the problem. Not only identify what is going on, but we need to identify, out of all the problems discussed in the scenario, what is the most important. Because if you don't understand that, as the questions progress, then you're going to find a lot of difficulty answering that type of question. So if we look at this scenario, how will you put it in order? What do you think will be the order of prioritization in order to formulate future care or future nursing interventions? Well, if we go back to the basics, we go back to prioritization guidelines, we know that Maslow's hierarchy of needs says that any physiological problem such as airway, breathing, circulation has the priority. So we know that the bulgy uterus and saturating peripads every 20 minutes, that is probably my priority because that indicates bleeding. Well, what will be second in priority? Well, the severe pain. We have to take care of that pain as well. What will be third in priority? Well, teaching the mother about the proper technique for breastfeeding. So, why am I telling you this? And what is the mistake that I usually think that you could encounter when you're dealing with a question like this. If you're just reading and not really thinking through as you read, you're gonna have to go a second time again and reanalyze the question once you see the prioritization question that is gonna come after this. But if you already have a structure in your mind, okay, yeah, I see that he has 3 problems: pain, difficulty with latching and breastfeeding, and saturation, saturating peripads. Oh, big problem here. This is ABC. That is my priority. Whenever you see a question that says, according to this scenario, what would be the most important action for the nurse to make? Your first thing is going to be, bleeding needs to be somewhere around here. Because you already analyzed the scenario with really putting details or looking at the details of the question. That is only a part of the clinical judgment process, okay? I'm only discussing the clinical judgment process, okay? We're not really going in details here.